It's unbelievable that 27 million Americans have asthma, and that's roughly 1 out of 12 people. Now, if you're diagnosed with asthma or know someone struggling with this medical condition, you're on the right page. In this video, we will tell you everything you need to understand about asthma and how to manage it. Before that, please subscribe to our Tune to Health channel and hit the bell icon to stay tuned for our health-related videos. Now here's a disclaimer. This channel does not offer medical advice. These videos and all comments and messages are provided solely for educational purposes and are not intended to replace professional medical advice, diagnosis, or treatment. Please always consult with your doctor or other qualified healthcare professionals if you have any health-related questions or concerns. In addition, the channel does not advocate for the use of any agents that are not approved by the Food and Drug Administration of the United States, FDA. What is asthma and its attack? Asthma is an inflammation of the air passageways to your lungs. It makes it a bit hard for you to breathe and can even make certain physical activities a little hard or downright impossible. In severe cases, asthma can lead to an asthma attack characterized by sudden and intense breathing difficulty. This happens when the inflammation grows too intense and in turn narrows the airways. The situation turns out to be so intense that air can hardly pass through. So what are asthma symptoms? Typical asthma symptoms include wheezing, coughing, shortness of breath, and tightness in the chest most of the time at night. Of course, these may vary according to an individual and can be mild or severe. And what can go wrong in an asthma attack? In an asthma attack, the individual usually suffers from symptoms such as continuous coughing, tightness of the chest, wheezing sounds during exhale, and shortness of breath. All of these take place in the air-conducting passages of your body called airways. They are channels through which air moves in and out of the lungs. Now visualize these airways as branches in a tree, breaking off from the primary trunk and narrowing as they fan out. Just as the air moves further down your lungs, the airways also get smaller. Mucus, a naturally produced sticky material, is known to block these already narrowed air passageways in an asthma attack. This would again make breathing harder by causing further blockage of the air passage. This is the detailed mechanism of an asthma attack. What are asthma causes and triggers? Although the specific cause of asthma is not known, some of the risk factors identified by researchers include the following. Genetics. If someone in your family has asthma, you're most likely to develop asthma as well. Several clinical studies have shown there's an association between ADAM33 gene and various features of asthma, such as lower lung function, increased responsiveness of bronchial, and progression of wheezing illness. Environmental factors. Some allergens or irritants such as dust mites, pet dander, and pollution can trigger symptoms in an asthmatic already predisposed to the condition. Some studies say that even children, when exposed to these environmental factors at an early stage of life, can develop asthma. Respiratory infections such as the common cold or flu can make asthma worse. The inflammations and swelling caused by infections further reduce space in the airways. Some of the triggers of asthma include allergens such as pollen, dust mites, molds, and pet dander, irritants such as smoke, air pollution, and strong odors, physical activity, weather changes. What are types of asthma? Now let's discuss how your healthcare provider would decide what type of asthma you have. So far, allergic asthma has been the most common. In fact, that's what 60% of all asthma cases are diagnosed as. That's huge. There are even some types of asthma connected to the life phase you're in. Asthma can manifest at any time in life. Still, there's pediatric asthma that's specifically in children. Then there's adult onset asthma that doesn't kick in until you're all grown up. Let's discuss about adult onset asthma. What is more interesting is that asthma can be triggered at any point in life. If you look at the demographics, it's more typically seen among people under the age of 40. However, it's not always a rule, and it's always possible that an older person may get an asthma attack, but the trend seems to lean toward more younger folks. What about pediatric asthma? On the flip side, studies show that pediatric asthma is often developed when the child is below 6 years of age, which accounts for around 75% of pediatric asthma. It can be a little difficult to make out because younger children cannot really explain how they are feeling and what symptoms they are getting. Thus, parents must keep observing for any signs or symptoms that their child is struggling with asthma. What other types of asthma are out there? Allergic asthma. The most common allergic asthma is caused by allergens like pollen and pet dander. Most of this type of asthma can be controlled and even be prevented if triggered by avoiding triggers and proper medical treatment. Non-allergic asthma. Non-allergic asthma refers to an asthma attack that is not caused by allergens but by other reasons, such as exercise, cold air, or some medications. This type of asthma can be a little hard to diagnose and treat, but proper medical care and changes in lifestyle can reduce the symptoms. Exercise-induced asthma. True to its name, exercise-induced asthma occurs when someone is exercising. This kind of asthma happens when someone breathes in dry or cold air during exercise. This causes the airways to narrow, and the person will find breathing difficult. Occupational asthma. Occupational asthma is a condition that mainly results from the many irritants available at the workplace. Consider being exposed to certain allergens, such as dust that is capable of causing you to be very uncomfortable, or the presence of dyes in the air that are not apparent but nevertheless are in the air you breathe. On occasion, gases and fumes can also be a significant factor in causing occupational asthma. Industrial chemicals found in many work environments can also cause asthma. You might not have expected it, but animal proteins and products like rubber latex are mighty triggers for such asthma. Take, for instance, the industries where all these irritants are prevalent. One such industry is farming. The dust, animal proteins, and even some of the chemicals used in farming can cause occupational asthma. Textile processes revolve around dyes and chemicals, both of which are asthma-provoking. Dust and a range of chemicals are also present in woodworking, which might be associated with increased asthma. Last but not least, industrial chemicals, gases, and fumes in such environments have increased the risk of this condition. Hence, being alert and preventive is the best thing a person can do, especially if he or she works in such environments. Dietary do's and don'ts of asthma. Several independent studies have shown that adults and children on a diet high in fruits and vegetables are less susceptible to asthma. Moreover, studies have found correlations between the intake of plenty of fruits and vegetables and the reduction in the signs of asthma, such as wheezing. This is because fresh vegetables and fruits are packed with a wealth of antioxidants, such as vitamin C, vitamin E, and beta-carotene. These power-packed substances help the body fight harmful toxins, minimize inflammation, and strengthen the immune system. On the other hand, a number of key food items and beverages, as well as other factors, can potentially trigger the symptoms of asthma. Therefore, patients with this disease should avoid such things. Take, for example, sulfites and salicylate, which are found in many food types and have the potential to exacerbate asthma. Then there are allergens. These would vary from person to person, but may also cause an asthma attack if ever ingested or inhaled. How to live with asthma and manage asthma properly. Asthma is controllable but not curable. However, it can be managed with proper medical care and some changes in lifestyle. Please work closely with your healthcare provider to develop an individualized treatment plan that works best for you. This plan could involve daily medications to help control symptoms and rescue inhalers for use during an asthma attack. There are a few other lifestyle modifications, apart from medication, that one can undertake to manage and prevent the onset of asthma. Avoidance of known triggers, maintaining a healthy diet and weight, regular exercise, quitting smoking, and bringing down stress levels. Moreover, inhalers should be used to counter acute asthma attacks. There are two types: short-acting beta-agonists, SABAs, and long-acting beta-agonists, LABAs. The SABAs provide immediate relief in case of an asthma attack, and the LABAs control the symptoms for the long term. Both should be subscribed by doctors and used accordingly. So that's all about asthma. If you like this video, please subscribe to the channel and give it a thumbs up.